So in the next section of the skeletal system, we're going to talk about articulations and movements. An articulation or joint is where two or more bones come together. And there are two methods of classifying joints. The first method is by the degree of motion, and the second method of classifying joints is by what fills the joint space. To classify a joint by the degree of motion, we have to look at the amount of movement that the joint can perform. And there are 3 degrees of motion classifications for joints. The first one is called synarthrosis, or non-movable or immovable joints. An example of an immovable joint would be the bones of the skull. The second classification for the degree of motion is amphiarthrosis, which are slightly movable joints. The example of a slightly movable joint pictured are the vertebrae of the vertebral column. And finally, the last classification for the degree of motion is diarthrosis, or freely movable joints. An example of the freely movable joint pictured here is the knee. The second method for classifying a joint is by structural classification. And in structural classification, we have to look at what fills the space between the joints, or between the two bones. There are 3 structural classifications of joints. The first structural classification is called the fibrous joint. The second structural classification is called the cartilaginous joint. And the last structural classification is called the synovial joint. The first structural classification of joints is called the fibrous joint. And in a fibrous joint, the space between the bones is filled with fibrous tissue. Examples of fibrous joints would be the sutures of the skull, a syndesmosis, which would be the interosseous membrane between the radius and the ulna, and gomphosis, in which the ligaments anchor the tooth to the gum. The second structural classification of joints is called the cartilaginous joint. And within a cartilaginous joint, the space between the bones is filled with cartilage. Examples of cartilaginous joints in the body would be the sternal costal joint, in which hyaline cartilage is found between the sternum and the ribs, or the costals. Another type of cartilaginous joint is a joint between 2 vertebrae, in which an intervertebral disc or fibrocartilage pad is found between adjacent vertebrae. And a last example of a cartilaginous joint would be the pubic symphysis, in which a fibrocartilage pad is found between the 2 pubic bones. And finally, the last structural classification of joints is the synovial joint. And within the synovial joint, the space between the bones is filled with fluid and surrounding supporting connective tissue. All synovial joints will have the following structures. Here you have 2 bones. And surrounding these 2 bones is the first structure of a synovial joint, called the synovial membrane. The function of the synovial membrane is to produce a substance called synovial fluid. Synovial fluid acts as a lubricant to help reduce friction within the joint. Synovial fluid is located within the joint along with another structure that also helps reduce friction within the joint, called articular cartilage. Surrounding the synovial membrane is a structure called the joint capsule, or fibrous capsule. The function of a joint capsule is to stabilize the joint. And finally, the last structure of a synovial joint is a dense, regular, fibrous connective tissue that connects bone to bone. This is called the ligament. Ligaments can be found surrounding the joint, or they can be found within the joint.